Yeah, so I think in this meeting we have seen a lot of data coming from different groups supporting the concept that Waldenström's is more than a single disease. We know of at least two subtypes right now, the memory B cell subtype and the plasma cell-like subtype. I think the names are up for debate because there are some complications in terms of what we think of when we talk about plasma cell-like subtype versus memory B cell-like subtype. And I think the naming much more refers to maybe the transcriptional features of what we know a plasma cell to be versus what we know a memory B cell to be. I think these two subtypes appear to have distinct genomic features, not perfectly so, but there are, for example, CXCR4 mutations seem to be mutually exclusive with the plasma cell subtype. Deletion 6q seems to be mutually exclusive with a memory B cell subtype. Again, this isn't perfect. You can have CXCR4 mutations in either subtype. You can have deletion 6q probably in either subtype. But it does seem to suggest that these subtypes may have distinct treatment response profiles, which I think matters a lot for our patients. And so I think what I'm looking forward to is everybody in the community coming together to figure out how to translate these research level findings into a viable classification system that we can then use in the clinic to determine which patient should get what treatment, which patient is more likely to progress, and what the outcome is going to be overall.